Hello, my name is Ashley, and I have been an occupational therapist at a rehabilitation hospital for the past 10 years, working with individuals with a spinal cord injury. A lot of research has been done on stretching, and the occupational therapist is a skilled professional educated in stretching of the upper body. Research has shown that consistent stretching increases strength, decreases pain, and prevents injuries in the body. Performing a daily stretching program is recommended for individuals with a spinal cord injury to prevent contractures, to improve blood flow to a muscle, to diminish spasticity, and to maintain overall joint health. The purpose of this video is to help you, the caregiver at home, to feel more confident and comfortable in performing a stretching on your loved one. This book, Prescriptive Stretching, How to Eliminate Pain and Prevent Injury by Kristen Berg, was published in 2011 by Human Kinetics and can be found at humankinetics.com. This was the resource for my video today. After watching this video, you should be able to remember the stretches of the shoulder blade, the arm, and the hand. You should be able to understand how to perform a stretching program on your client, and you should know how to modify your stretching program if your client has shoulder subluxation. Before we get started, there are a few things that you should know about stretching of the upper body. First, do the stretches every day or as often as directed by your occupational therapist. You should always begin by stretching the shoulder blade first and then the shoulder. Move the person slowly, gently, and smoothly. Avoid fast or jerky motions. Each joint should be moved as far as it will go. Move each joint to the point where you feel some resistance. The person may feel discomfort, but do not push to the point where it hurts. Hold that position for 10 seconds, then return the person to the resting position and repeat this pattern 3 times. And always stretch both sides of the body. Ideally, stretching of the upper body is performed with your client lying down on a flat surface, such as a bed or a mat table at home if you have one, so that your client is as relaxed as possible. However, stretching may be performed in a seated position as well. Today, I'm going to show you a stretching program on a client in a seated position so that you have a better visual image of my hand placement. I'm going to first begin by stretching the shoulder blade. I'm going to cup the shoulder blade on the vertebral side or by the spine with my fingers. And I'm going to pull the shoulder blade in the outward direction. I'm then going to use the heel of my hand. I'm going to push the shoulder blade back in towards the spine. I'm going to pull it out and push it back in. And I'm going to repeat this gliding motion inward and outward. I'm then going to rotate my hand so that my fingers are pointing downward towards the hip. And I'm going to pull the shoulder blade up towards the ear. And then I'm going to use the heel of my hand to push the shoulder blade back down towards the hip. I'm going to pull it back up towards the ear and back down towards the hip. Then I'm going to cup the shoulder by placing one hand in front of the shoulder and the other hand in the back. And I'm going to do a backward shoulder circle. And I'm going to overlap my hands on top of his shoulder by placing one hand down on the upper trapezius and then the other hand on top, and I'm going to push down. This is the only stretch that is performed one time and held for 30 seconds. Now I want you to pause your screen and do this stretch to make sure that you've got it. I encourage you to do this after each stretch so that you make sure that you understand the stretching program completely. Before stretching the shoulder, it is important to check to see if the person you are stretching has shoulder subluxation. Shoulder subluxation, or shoulder instability, occurs when the shoulder partially dislocates. This stems from the changes in the mechanical integrity of a joint that is common in higher level spinal cord injuries. If shoulder subluxation is present, there will be a gap or a separation in the shoulder joint. If this is present in your client, first, push the upper arm bone into the shoulder. If you are able to correct the subluxation by doing this, proceed by stretching the arm overhead. If you are not able to correct the shoulder subluxation, Electrical stimulation may be applied to the shoulder by placing one electrode on the supraspinatus, or the top of the shoulder blade, and the second electrode on the back of the upper arm, or the posterior deltoid. An electrical stimulation program may be issued to you by your occupational therapist and applied while performing the stretches of the upper arm to prevent this shoulder subluxation. If you do not have an electrical stimulation device available to you at home, then perform the arm stretches to 90 degrees and do not proceed by stretching the arm overhead. This is not safe for the shoulder. So today I'm going to continue by demonstrating a stretching program on a client that does not have shoulder subluxation. To stretch the shoulder, we're first going to begin with shoulder flexion, or just moving the arm up overhead. I'm going to cup the wrist, I'm going to cup the elbow, and I'm going to always move the arm in the direction with the thumb leaning upward. I'm going to bring the arm up overhead slowly until the point where I feel some resistance. I'm going to hold for 10 seconds. A common mistake here is for the caregiver to bring the arm outward here. The correct position should be in towards the ear. The second stretch is shoulder abduction. If you are sitting down, this is as if you are doing a jumping jack. If you're lying, it's as if you're doing a snow angel. Again, I'm going to hold at the wrist, hold at the elbow, and I'm going to lead with the direction of the thumb. I'm going to come upward towards the ear until the point of resistance, hold for 10 seconds. Here, a common mistake is to come too far forward, such as that, when the correct position is really all the way out here by the ear. Next, I'm going to do horizontal adduction, or crossing across the body. Again, the same hand placement, I'm leading with the direction of the thumb, and I'm bringing the arm across the body. The elbow needs to stay nice and straight. A common mistake here is to drop the arm too low when the correct position is across at 90 degrees. Arm out away from the body into horizontal abduction so I can stretch this pectoralis muscle, or this chest muscle here in front. Again, keeping the arm nice and extended. And then going to bring the arm into external rotation, or as if your client is doing a waiter's tray position. Here, the shoulder is at 90 degrees, the elbow is at 90 degrees. I'm holding at the elbow, holding at the wrist, and I'm bringing the hand in a backward direction, stretching this front part of the shoulder. Then get a hold of the elbow, drop the hand as if your client is putting his tips in his pocket. If this position is too painful for your client, you can drop the arm bone, the upper arm bone, to 45 degrees and bring the arm in and stretch the rotators this way. Next, I'm going to stretch the elbow. I'm going to bend the elbow in as if I'm doing a bicep curl. I'm going to hold at the elbow, hold at the wrist, and just bring it in. And then going to extend the arm by pushing up on the elbow to maintain this nice extension here and pull down on the wrist and the hand to get this nice stretch here. I'm now going to stretch the forearm. I'm going to hold at the wrist and I'm going to rotate the palm upward. This is very important not to torque at the wrist. This is actually a stretch of the forearm here and not the wrist. So I'm going to place one hand by the thumb side, one hand by the pinky side, and simply rotate upward gently. And then going to rotate the palm downward towards the floor and hold. Next, I'm going to stretch the wrist and the hand. It's very important that the hands stay in a neutral position here. So I'm going to cup the wrist here. So I don't want the wrist in extension and I don't want it in flexion, but just right in neutral or in the center of the wrist joint. I'm then going to put one thumb on the knuckle side here of the hand and my fingers under the fingertips. I'm going to bring the fingers straight upward as if I'm making a steep groove. And then going to bend the fingers. So this is a 90-degree angle here. And the fingers are staying nice and straight. And again, my wrist is still centered. I'm going to bring the fingers back up into my C groove and down into a flat groove. I'm going to alternate this position, my steep groove and my flat groove. I'm then going to bend the fingers at the knuckle here, the center knuckle, as if I'm making a bear claw. I'm going to take it back up to my steep groove and down to a long fist. The difference between a long fist and a regular fist, here's a regular fist, here's a long fist, where the fingers are going down towards the heel of the hand. So I'm going to repeat that sequence. We're going to start at a steep groove, a bear claw, a steep groove, and a long fist. One more time. Steep groove, bear claw, steep groove, long fist. The last stretch is at the thumb. We're going to bring the thumb, I'm going to cup it with one hand to keep that joint nice and stable. I'm going to bring the thumb in front of the pointer finger as if I'm making a C of this web space. Bringing it in front. My other hand is just supporting the hand in neutral. And I'm going to bring the thumb out to the side as if I'm making an L here. Again, just cupping that thumb joint to keep it nice and safe. I'm going to alternate between a C and an L. And that completes the stretching program of the upper body. Remember, always consult your occupational therapist if you have additional questions. Thank you.